We're finally here. I'm so excited about this live. Dr. Newton is going to have so much information. Thanks for being patient with us. And I'm going to let her introduce herself because she is an awesome doctor and an awesome person. And I'm glad you all are going to have a chance to get to know her a little bit.
Thank you, Monica. I am Dr. Emily Newton. I am both a licensed clinical psychologist and a board certified behavior analyst. And here at Access for Autism, I am the vice president of diagnostics. So I get to oversee and work with our amazing diagnostic team that diagnoses individuals from 17 months through adulthood with autism and other co-occurring diagnoses, which is why I was very excited about today's topic. So we are going to spend this time talking about how to understand the co-occurring diagnoses, or when autism isn't the whole picture. So we're going to talk a little bit about understanding what a co-occurring diagnosis is, learn which are most common alongside of autism, understand how diagnoses can overlap, and then recognize signs that deserve further evaluation. So my hope is that you walk away being able to really focus on your child as a whole picture and not just an autism diagnosis if there is perhaps other diagnoses occurring. So I don't know about you all, but when I go and listen to presentations, either at conferences or even if it's somebody on social media, I become the caterpillar from Alice in Wonderland and say, who are you? Why do you have the experience that you have, that you feel like you can talk on this topic or give out advice? So as I mentioned, I am both a licensed clinical psychologist and a board certified behavior analyst, meaning that I've spent my career in both assessment as well as treatment. So I have been able to be part of a family's journey from the very beginning through treatment. And I've been very fortunate to work with the autistic community for my entire career. Much of that was spent with families and clients with complex problem behaviors and dual diagnoses. So I've been very fortunate to be able to learn a lot from the individuals I work with and the community at large. So I'm going to start off with an example. So meet Liam. Liam is a 5-year-old autistic boy who communicates using single words and short phrases. He enjoys trains, loves swimming at the playground, and usually has a predictable routine. Over the past week, his parents have noticed something new. Several times a day, Liam suddenly begins hitting the side of his head with his hand. Sometimes he'll cry while doing it. Other times he just seems upset and walks away from whatever he's doing. Nothing else in his routine has changed. His sleep has been about the same, and his teachers say they are seeing the same behavior at school. So it's happening at school and at home. Liam can't tell his parents, my head hurts, or that I don't feel well, so they aren't sure what's going on. So the thought here is, what might be causing Liam's head hitting, or might be causing him to hit his head? So if we consider that the head hitting is related to autism, this might be him experiencing some sensory overload. He might be frustrated with communicating or have something he's trying to communicate and can't, or he might be having difficulty regulating his emotions. But my hope is what you got from that paragraph about Liam is not a lot in his environment has changed or in his day-to-day. So then we should also consider, is it something outside of the autism-related or autism diagnosis or unrelated to it? So it could also be that Liam has a toothache. It could be that Liam's getting sick. He might have an ear infection. He might be having a medication side effect if he just started a medication. He might be experiencing seasonal allergies causing sinus pressure. He might be having a headache or a migraine. He might be going through some vision changes. He might have anxiety. He might, less commonly, but he might be experiencing seizure activity or something completely unrelated to anything medical or autism. And one of the unfortunate things that happens oftentimes when someone already has an autism diagnosis is anything new or anything different is attributed to the autism, right? So Liam's hitting his head because of the autism, when in actuality, it may be related, but also it might not be. And so it's important to think about, what could Liam be communicating to you through that new behavior? So, what is a co occurring diagnosis? It is something that is another medical or developmental or mental health condition or diagnoses that exists alongside of autism. It doesn't replace the autism diagnosis. It simply means there's another piece of Liam or of your child that helps us better understand who they are and what they need and how we can support them. So, some examples of common co occurring diagnoses are ADHD, anxiety, depression, as well as epilepsy, sleep disorders, and GI disorders. So why does it matter? Because untreated co-occurring conditions can look like behavior problems. It can look like somebody is experiencing a skill that they're not able to do when they previously could, also known as regression. It could look like non-compliance. It could look like somebody not willing to follow a demand placed in front of them or not willing to do a routine that they typically would. It can also look like they're intention seeking. They're looking to act out in order to get that response. When in actuality, they might be experiencing pain or anxiety. They might be having sleep problems or ADHD or depression. So it matters because it oftentimes could look like one thing. And if you start to treat the one, you might be missing something else. So I'll give you a real world example. When I experience somebody who is having the head hitting, like Liam's example, if Liam never hit his head before, if that wasn't something that was there and went away, he doesn't have any behaviors that look similar, like pressing his palm to his head. If it truly is brand new, I'm not going to treat it like a behavioral problem from the jump. What we're going to do is we're going to work with Liam's family in order to work with Liam's pediatrician or other doctor in order to find out if it could be something medical. Because the problem is, if Liam is trying to communicate something medically is happening inside of his body, or that he's having a pain or an ache or a mental health concern, just treating it as a behavior problem is not going to address really what's happening with Liam and may actually make it worse. So symptoms overlap. This is the biggest challenge and why we oftentimes see what we call overshadowing, or, it's just because of the autism. So with that symptom overlap, one behavior can have a lot of different possible explanations. So a child who doesn't answer questions, he may have anxiety about being in that classroom. Let's say a child doesn't answer questions and raise their hand in class. It might be that they have anxiety about the answering questions in class. It might be that they don't have the way to communicate the answer to the question. It might be that they have ADHD and weren't paying attention, and were really excited about the picture of the squirrel that's up on the chalkboard. It might be that I have difficulty hearing the question and they weren't able to comprehend it. They might have difficulty with expressive versus receptive communication. So they understood the question, but being able to communicate what they wanted to say outward could be difficult. Or it could also be that they have autism too. So oftentimes, without a comprehensive evaluation, if something is occurring, we may miss another explanation that for what is happening or another piece of the individual. So research shows us so this comes from the CDC, 95% of those diagnosed with autism also have another diagnosis. And when we say another diagnosis, that might be something medical, it may be something behavioral, it may also be something in regards to mental health. But 95% of those with ASD, with autism spectrum disorder, also have another diagnosis. And of that same group that was researched, 50% had 4 or more additional diagnoses. So 95% had at least one more, and 50% had at least 4 or more diagnoses. So the point, I hope the takeaway here is that this is frequently happening within the autism population, that there is another diagnosis present for the individual. So this study that was done in 2022 showed that as many as 85% of children, so the previous study was any individual with autism, this is children, also have some form of comorbid psychiatric diagnosis or mental health diagnosis. So if you look here within the moving brain, 30% of within the study, this group that was looked at, 30% had anxiety, between 50 to 70% had ADHD, 50 to 80% had sleep disorders, and 26% had depression. So a mental health diagnosis is very common within the autistic community.
Doctor, I do have a question.
Yes.
How can parents tell whether a behavior is part of autism or something else that may indicate a co-occurring diagnosis?
Yeah, I think one of the best ways is to talk to the other individuals in your child's life. So talk to
Okay.
the teacher, talking to a therapist, talking to the primary care physician or pediatrician. If you're wondering if a behavior is related to autism or to potentially something else. So, for example, a sleep disorder. If you're concerned that your child is not sleeping well, and there may be something going on in addition to some sensory concerns, that is a great thing to go to your pediatrician and say, Liam's not sleeping. And because Liam's not sleeping, I'm not sleeping. I'm wondering if that's related to his autism diagnosis or might it be something else? So I think talk to the other professionals in your child's life. They can also refer you for what we call a comprehensive evaluation.
Okay.
So meeting again with a psychologist, or if it's a medical concern, being referred to a specialist like a sleeping disorder specialist.
Oh, I see. Thank you.
It's a great question. Thank you. So possible difficulties associated with an autism spectrum disorder diagnosis. We know that when diagnosed with autism, this occurs with difficulty with social situations, behavioral problems, handling changes or inflexibility, a lack of observational learning, meaning that you have to be explicitly taught something, especially like a social rule, versus being able to observe it from others and learn it. Difficulties in receptive language, so understanding the communication from others, difficulty in generalizing skills, low attention or distractibility, repetitive behaviors, and difficulty communicating your need for help. Now, these are possible difficulties. Not everyone has all of these. Not everyone may have any of these. But I think what's important to know here is that these common identified difficulties associated with autism can also be associated to other things. So, for example, low attention distractibility can also be ADHD. Difficulty with learning, whether it's observational or not, can also be ADHD. When we look at social skills, it could be social anxiety. So that individual is nervous about communicating with others. So again, these pieces that are part of an autism diagnosis can also be related to other diagnoses as well. So when we consider mental health, there was a study, a great study that was done by Kearns et al. In 2021, and they interviewed 42,000 caregivers across the United States and Canada. And what they found in those interviews is that these caregivers noted that 78% of their children with autism had at least one mental health condition. So again, what is important when you hear studies or you see research is you should want to know, was this just a single study, or were we able to see these results, what we call replicated or shown again and again? So when we look at the current study, you should think about the previous study that said 85% of children had a mental health. This is 78. They're not exact numbers, but they're very similar. And that means that we're seeing that replicated or repeated when we look at different groups of individuals with autism. And that's how you know that something is sound or safe research to really believe and understand. 14 of those, but what's important here too is to look at the population of those with and without autism. So in the study, 78% of children with autism had at least one mental health condition, compared to their peers without autism, who only 14.1% had mental health diagnoses. So what we do know is that individuals with an autism spectrum disorder diagnosis have a higher percentage or higher likelihood of having a mental health disorder than their peers. That doesn't mean that just because you have autism, you're going to have a mental health disorder, but it means that it's really important for us, for you as caregivers, to pay attention to the possibility that your child or your adolescent has is experiencing anxiety or depression or ADHD, because they are more likely than their peers to experience those type of things. So I always like to put this in perspective for us. So imagine you didn't sleep well last night. In fact, you haven't slept well the last couple of nights. Your body feels harder to move, you're having difficulty concentrating, and you have a headache. You wake up and your child reminds you that you promised pancakes for breakfast and they don't just want to eat cereal this morning. On any other day, you'd laugh it off, you get out that pancake griddle. But today, your patience is gone. Before you even had coffee, you snap. Not because you don't love them and not because you're failing as a parent, but because an exhausted brain does not have room for one more thing to go differently than planned. Now imagine that you couldn't explain any of that. You couldn't say I didn't sleep well, and you couldn't say my head hurts. All you had was behavior. So it's important that we remember before we call it behavior, let's make sure it isn't something else first. And it's really relatable. If you think about the 3 most common medical conditions that co-occur with autism are seizures, gastrointestinal concerns or GI concerns, and sleep disorders. And if you've ever had a really bad stomach ache or been really constipated or had a really bad night of sleep, you know that affects how you function. And it can affect in different ways. So that's why it's important to pay attention to these pieces and not just dismiss them, because it can really impede your everyday life. And so in this case, right, this example of somebody who would normally just be like, yep, you're right, I promised to make you pancakes, let's go ahead and knock that out. They snap. And they don't snap because they're trying to hurt their kids' feelings. They don't snap because they're being a bad parent. It's because they are exhausted and they can't do what they would typically do in that scenario. And so I think it's important to put yourself in that moment so you can appreciate why a co-occurring diagnosis, why it is important to examine that, to go to one more evaluation or consider is something else going on.
Can you give any advice on how parents can keep track of those behaviors? Maybe
Yeah.
write them down. So then when they go to their provider, how can they, what's
That's a
a
great
good way to keep track of that?
That's a great question, Monica. And remember, I've worked in the ABA field, so my favorite thing is going to be data. Data is the best thing you can do. So one of the easiest ways is either on your phone calendar, or if you have a paper calendar, you can buy them at the Dollar Tree for like $1.25. Just have a calendar up on the wall, and when it happens, make a mark for yourself.
Okay.
And what we call that is frequency data. It's how often it's occurring. You can also make other notes to yourself, but simply just saying, yep, it happened this day. And so that you can start to also look for patterns too.
Oh,
and you can help to talk to your doctor about, I noticed that this seems to happen in the spring and the fall. I really want to get my child tested for seasonal allergies. It doesn't happen in the summer. It doesn't happen in the winter, but the deep pressure they're putting on their head, they have difficulty sleeping, their eyes are really watery. That happens in the spring and the fall. And so you're able to produce that data, or in this case, the calendar for the doctor too. The other thing I really like is you can actually send text messages to yourself. And so if you're somebody who that is easy, for me, that's an easy thing, just to send a quick text. So
that's
you can
a great idea.
That says, little Liam woke up super grumpy today and didn't want to eat anything, really not normal. Boom. And that way, if you want to go back and look, you have it all right there. And it's something that you don't have to think extra about.
That's a really good idea. I haven't thought of that. I'm going to start doing that for my daughters.
I do it a lot to myself. I send myself text a lot. But I think
that's great.
It's hard. As a parent, you've got a lot that you're juggling. So if you can find easy ways or things that you're already doing, that makes it easier too.
But thank you.
Yeah. I will also say, Monica, too, one of the other things I'll say, and I can almost guarantee it, if you go to the doctor without that data, they're going to ask you to go take it and come back. So if you've already anticipated that and you can come with data, you're taking a step ahead too.
Okay. Yeah. Thanks for the advice.
Yeah. So as I mentioned, these are the three most common occurring medical comorbidities or co-occurring. So children with autism are about 10 to 20 times more likely to have epilepsy than their peers. Children with autism are 4 to 70 times more likely to have GI condition, and then sleep problems occur within about 50 to 80% of those with autism. Epilepsy, it might just mean a single seizure event versus a full diagnosis, but it's less common than the other two, but it is more common in individuals that have autism than their peers. GI conditions can be a lot of different things. This can be constipation, this can be diarrhea, this could be acid reflux or GERD. And oftentimes GI conditions, especially for someone who doesn't have the way to communicate it, can look like aggression because your stomach hurts. You can't explain why. We also see things like digging in their behind in order to relieve the pain if it is constipation. So this is very common. There's a lot of medications that can help or ways to go about this. So don't be afraid to bring this up to your pediatrician. It's very common. And then sleep difficulties. This is the one that, in addition to the GI concerns, I would absolutely encourage parents to advocate. If your child's not sleeping, I guarantee that you are not sleeping. And if you're not sleeping, you're not able to help for anyone, right? We can't pour from an empty cup. So if you're not sleeping, you're not going to have the ability to advocate for your child. You're not going to be able to support in different ways. And their sleep is absolutely affecting yours. I can guarantee it. So if you have my permission to say to yourself, kids should be able to sleep so that I can sleep. That's not a selfish request to go to the doctor and say my child's not sleeping and it's affecting my quality of life. That's not selfish. That is actually helping your child. So back in 2020, I worked at Nationwide Children's Hospital, and I wanted to disprove this concept of overshadowing, right? This concept of, oh, it's just the autism, as people would say. So what I did at that time is I asked all of the BCBAs who worked in our clinic to look at a couple clients' charts and just pull out the departments that their client also saw. So the idea here was, tell me all of the different departments at the hospital that your client has appointments at outside of just us at the Autism Center. And now, this is not a perfect list. I'm sure there's things absent. I'm sure, and this was a very small sample, one specific hospital, one specific group. But your takeaway here should not be that these are all of the ones that your child should be involved in or can't be involved in anything else, but that individuals with autism have appointments in many other different types of clinics. And so I've also used this to talk to medical professionals in every discipline and say, you will interact with an autistic person. You need to be aware of what autism is, because these individuals will be in your clinic. And if you are not paying attention to ways in which you can support them, you're not giving quality care. And I think the inverse is true as well, in that we need to dismiss the rumor that it's just the autism and allow it to overshadow, and really acknowledge that individuals who are autistic are going to have different medical conditions or have different needs and will be present in all aspects of medical care. So a co-occurring diagnosis is another condition that exists alongside of autism. And understanding these diagnoses isn't about giving someone more labels. It's about being able to see the fuller picture of who they are. So the important thing here is to be able to really see the full child. And one of the greatest risks in autism isn't overdiagnosis, it's under recognition. I really love this quote, that sometimes everything gets blamed on autism and we'll miss anxiety, depression, pain, or ADHD. And so that to me is so important here in really seeing the full picture or the whole child amongst just an autism diagnosis. So, one of the questions is when should you, I think we brought this up a little bit earlier too, when should you seek out another diagnosis or another evaluation, or when should you be talking to your pediatrician? The best advocate your child will ever have is you. You are the one who sees them across different areas. You are the one who knows them best. So if you notice a truly new behavior, one you've never seen before, if you notice significant mood changes, they are very different than they were on a regular basis. All of a sudden, they're extremely grumpy. They don't want to do anything they normally would, when normally they're a pretty happy, engaged, and smiling kid. Sleep deterioration. So that can look a lot of different things. That could be having difficulty falling asleep. That could be having difficulty staying asleep. That could be waking up for 2 or 3 hours in the middle of the night when they used to sleep soundly. Something happening to their typical sleep patterns. Major attention concerns. They're not able to engage, and either that's new or that it's continuing. Sudden loss of skill. So again, they were able to do something and they're not demonstrating it. Increased aggression or self-injury too, and school refusal or refusal of any previous activity that they would actively go to. So what can parents do? You can become a detective. And this goes back to Monica's earlier question. You can observe, you can keep notes, take data, and then start to ask yourself questions. When did it start? What changed? Is it happening everywhere? Is it only happening a specific place? And then what is my child trying to communicate? This is an assumption on our part, but is there a chance that we can identify what they're trying to communicate? And I think here too, don't try and solve it. Stay curious. Stay curious into really thinking about what are the things that are happening around the behavior. What I always use the phrase like pull the camera lens back. If you were doing a video shoot, for example, right? Zoom out and look at what else is going on. So I mentioned if it's allergies and you're noticing it's a really, you hear on the news about a bad pollen day, make a note of that happened to overlap. Sometimes it's hard to see the forest amongst the trees. Sometimes it's hard to see the pattern. So if you can take notes and then provide them to the pediatrician, the speech therapist, the occupational therapist, the teacher, they might be able to identify something that maybe you weren't able to see. So Monica, I think I went through that very quickly.
Well, I do have questions from parents that they send them ahead of time.
Yeah.
One person did ask if boys and girls are affected differently.
So that's a great question. I think we know that boys have a higher rate of diagnosis of autism than girls, but the co-occurring diagnoses don't seem to differentiate between the two. One of the things to know, though, is typically at younger age, girls are more internal and boys are more external. So there is a chance that you may more quickly identify something going on with a boy than a girl because they might be externally demonstrating something you're able to identify quicker. Like, for example, a boy with ADHD who's acting out in class versus a girl who has ADHD who is quietly reciting the alphabet to herself. In her head, that you might not know she's not paying attention, but the boy who is getting out of his seat multiple times, you're able to better see that quicker. So I wouldn't necessarily say that co-occurring diagnoses tend to go one way or the other with boys versus girls, but I think it might be easier to identify.
Thank you. We have another question. So if a child receives another diagnosis, does that change their therapies or treatment plan?
Yeah, that's a great question. So I think that having more information can help know if there's anything additional to add. It wouldn't necessarily take away from what you're already doing if you have ABA, let's say, or speech or occupational therapy, but there might be some added components or different pieces that you'd add in. So I would say it doesn't take away, but it might add to.
Okay, thanks for that answer.
Oh, can I add one more thing, Monica? Yeah. Just from thinking about it on that note. I think oftentimes, and I hear this a lot too, parents or caregivers are nervous about getting an evaluation for a co-occurring diagnosis because they're worried it might mean they have to take medication. And so just so everybody's aware, if you have an ADHD diagnosis, if you have anxiety or depression, that does not mean you need medication. There are other strategies to use, behavioral strategies, for example. So I know ADHD, there's a lot out there on using medication, and that is absolutely one option. But don't be afraid of getting that evaluation. Nobody will force your child into taking medication because you've had that evaluation.
So, a person asks, how can a co-occurring diagnosis affect school, friendships, or learning?
Yeah. So I think that one of the things we know is there's a lot of overlap with ADHD and anxiety and autism. So difficulties socially can occur across all three. Diagnoses, but also if you have multiple diagnoses, you can see that present as well. So I think that we know with ADHD, for example, you might interrupt conversation because you're really excited to jump in and join the conversation. And that might be difficult to know when to join a conversation or how to join a conversation. And we see that within autism as well as a possibility of an area for support. So I think socially, all three of those, or really any co-occurring diagnosis, can affect in different areas. And once you have the diagnoses, it's really helpful to go back to your supports, such as an IEP, and make sure that all services that would be helpful are available to your child.
Thank you. Also, I got this question a couple of times, and they want to know, can a child outgrow a co-occurring diagnosis?
That's a great question. Can a child? I think a child medically, I think we can see that for sure, that you can outgrow. I wouldn't necessarily say outgrow, but maybe as your body develops, that you're able, you might experience a lot of constipation early on, and your body, naturally navigates that, or with medication. One of the other things that we see too is puberty. Puberty can change a lot.
Yeah.
So somebody who maybe had sleep difficulties earlier on, puberty hits, and now they love to sleep. So I think similarly with mental health diagnoses and behavioral diagnoses, I wouldn't necessarily say that someone can outgrow them, but with support and intervention, they may no longer demonstrate symptoms or difficulties of them. So similar, where we say that you wouldn't necessarily outgrow an autism diagnosis, but that over time, your experiences, your behaviors, areas you have difficulty with may ebb and flow or change. Similar, I would say, for mental health concerns.
Thank you.
Yeah.
What advice would you give parents who feel overwhelmed because they think their child may have a co-occurring or multiple diagnoses?
Yeah. I would say that is a very fair feeling, to feel like here's another piece of my child that it could be scary. It might feel overwhelming. So I would ask yourself, why is this important right now? And if it is that your child isn't sleeping, let's say, and that's affecting your sleep, then could this extra piece of information help get to a place where you feel more comfortable sleeping, or you have more ability to sleep? Or, is there a component where with the supports that your child is currently receiving academically, knowing that your child has ADHD would also help and support in some of the strategies that they're receiving? But I would also say is, if this is not the right time to evaluate that, and there's not some significant behavioral or medical concern, it's okay to wait until you have the capacity to seek out that evaluation. Of course, if your child's hitting themselves in the head or so constipated they're not having bowel movements, I would encourage you to seek support. But if it's a question of, my child's 6, they might have ADHD, but I don't have the capacity right now to go through another diagnosis or another evaluation, that is okay to wait and see when that would be the best outcome for you.
Okay, great. Thank you.
Yeah.
I know we discussed this briefly, but what kinds of professionals are involved in the evaluations when it's multiple diagnoses?
Yeah, so when it's typically a medical diagnosis like a GI concern or epilepsy, that's going to come from a medical specialist. So GI would be a GI specialist, a gastrointestinal specialist. Epilepsy is typically a neurologist. Sleep, you might see a sleep disorders expert, or there might also be like a developmental and behavioral pediatrician is another great option. When it comes to the mental health side, typically it is your pediatrician or a psychologist who would be evaluating that.
And when should they bring those concerns? Because I know, do you have like a certain time? Because we're keeping track, of like a daily, like a calendar. When
Yeah.
should they bring that to their provider?
Yeah. I
Those
think
concerns. Mhm.
I think when any time is a good time to talk to your
Okay.
doctor about concerns. I would not shy away from it. I would say that if you have an appointment, let's say today's Tuesday, if you have an appointment on Thursday, you might not have enough
Okay.
data to collect.
Yeah.
So,
Okay. Hmm.
um, I think if you have a doctor or pediatrician that schedules a week or two out, when you call to make the appointment, start taking the data then. But I don't think it's ever a bad idea to reach out. But I would, if it's something where you're waiting to see a pattern, or if you're like, it happened 4 days in a row and this week it hasn't happened at all, maybe give yourself a little more time, because you might see it come back, or there might be some changes for that child.
What could you say to, let's say, families that worry about their child? Like if they get another diagnosis, that means that maybe their autism is getting worse. What advice could you give them?
Yeah, absolutely. I think what I would say is this is not going to change your child. Your child is still the amazing, wonderful child that they are before a second co-occurring diagnosis, or more, even before their autism diagnosis. This is another way of seeing your child as a whole, as to see the full picture of your child in the ways that you can support and better understand their needs. So this, a way to consider it is this if you had done things in a different order, right? So if you had already had the co-occurring diagnosis, let's say of ADHD, and now you're considering autism, it's similar in that it's not necessarily that the autism is getting worse. This might be related or it might not be, but it's another aspect of making sure that you are supporting your child in ways that they need support.
Thank you. Um, Let me see. Do you have any information or any advice on like maybe websites or resources that you recommend parents in
Yeah,
regards to this?
that's a great question. I wish I would have thought about that one ahead of time, Monica. That's a really great
Or you know
question.
what? We can leave it in the comments after. That's
Yes, I love
I'll
that.
leave, yeah, or we can
I
create
will,
a post. Okay. Yeah.
yeah,
Yeah.
I will absolutely pull some resources on, just understanding different components
Mhm.
and how to connect. I will
Because that's
definitely.
always good to have. We get those questions often, and I'm always like searching. So we'll create
Yeah,
a special post for that, and then we'll post it here in the comments,
yes.
and then yeah. So that's
I'm
perfect
making myself a note.
for
See,
okay.
this is mine. I always have notes
See,
over my.
you're texting yourself.
I'm texting myself right now. My mental text.
I'm, I will start doing that. That is actually a great thing because I always use the notes on my phone, and I'm like,
Yeah,
okay, I always go. I have I don't know how many, like 10,000 notes already, but
yeah.
that's actually a better idea. Just text, and I can just go back and look. It's
It's
dated. It's perfect.
Oh yeah,
Mhm.
absolutely.
It's
I always
organized.
when I previously when I was running a different team, I would always say, if you were a parent, would you want to use that data sheet? And if the answer was no, then go back to the drawing board, right? Because I think
Mhm.
parents are incredible in how much they are doing for their children, especially parents of autism, kids with autism or autistic kids.
Mhm.
And so little tips and tricks like that, where it doesn't take extra time or extra
Yeah.
labor, finding where I put that data sheet is going to help make sure that you're actually able to implement that. But a suggestion with like a laminated data sheet that you have to go find somewhere uh,
Yeah.
is too hard.
Yeah. Everybody's always on the go. Just
Everyone,
texting.
especially
That's this.
now,
Mhm. Yeah.
everyone's at their capacity.
It's fast.
Everyone.
Mhm.
So the more that we can do to help find
Mhm.
easy answers, the better.
That is great. Thank you. And lastly, what message, if you would like to leave a message for our Parent Alliance community,
Yeah.
what message would you leave them just in regards of co-occurring diagnosis?
Yeah. I would say that gut instinct that you have is powerful. And so if you feel like there's something else going on, trust your gut. Take data or talk to the therapists or the providers in your child's life, and then talk to your pediatrician. But that gut that's telling you there's something else going on, or this behavior wasn't there before, or why is she not sleeping anymore? She was sleeping just fine, or she hasn't had a bowel movement in a really long time. That little gut or the little voice in your head, listen to it, trust it, stay curious. You are your child's best advocate, and don't give up.
Thank you so much, Dr. Newton. It was a pleasure having you. Thanks. And thank you, everybody, for watching. And I'm sure we'll get way more questions afterwards. A lot of our community watch the lives afterwards. So I'll probably be sending those questions over to you, and then we'll get those replies to everybody.
Wonderful. Looking forward to it. Thank you.
Thank you. You have a good rest of your day.
Bye bye.
Bye.